Welcome to the deep dive. We're tackling a topic you sent us sources on today, feline skin fragility syndrome. Sounds, well, pretty
We
intense.
really dug.
So our mission is to unpack these sources you shared, figure out what this condition actually is, what's really driving it, how vets diagnose it, and what the outlook is for these cats.
It's definitely a striking condition.
Yeah.
The core thing you see, based on this material, is skin that's incredibly fragile, tears with almost nothing.
Right.
But, and this is key from the sources, it's almost never just a skin problem. It's usually a big flashing sign of something much deeper going on inside.
Okay, so let's start there. What is it fundamentally? You said fragile skin, but the sources, I mean, they describe it tearing from just normal petting.
Yeah, or grooming themselves.
Or jumping off a chair. That seems unbelievably fragile.
It is. And the way it looks is pretty distinct, according to the material here. The tears often don't bleed much, which is interesting.
Really? Huh.
Yeah, and you might see lots of tears, sometimes irregular shapes. One source even mentioned a specific W shape sometimes.
A W. Okay.
And the skin itself can look super thin, almost see-through. You can sometimes see the little blood vessels underneath. Plus, the fur coat is usually poor in those areas, maybe even bald patches.
And I saw in one source, it mentioned this often creeps up gradually. It's not like, boom, suddenly fragile skin.
That's right.
And it comes with other signs, too, like the cat losing weight, not eating well, just low energy.
Exactly. And
Yeah.
those things, the gradual start, the weight loss, the lethargy, they're huge clues. They tell you straight away, this isn't just, a simple cut or infection.
It points to something bigger.
Something systemic, yeah.
Yeah.
Affecting the whole cat. The skin is just screaming the loudest, basically.
So the skin's a symptom. Okay, let's get into the why. What's fundamentally broken, according to this material?
Right. So the core issue described in these sources is a major problem with collagen.
Collagen, okay. The stuff that makes skin strong.
Exactly. It's like the scaffolding, the structure. In this syndrome, FSFS, the sources say there's a serious lack of good quality collagen in the dermis, the deeper skin layer. The structure's just flimsy.
And what makes the body fail at making that collagen? What breaks down?
This is where we get to the root causes. And the main mechanism, the one that's best understood based on these sources, is having too many glucocorticoids.
Glucocorticoids, you mean like steroids, cortisol?
Precisely.
Yeah.
Steroids. When there's an excess, whether it's from medication or the cat's own body, it messes with the cells that build collagen. Those are called fibroblasts.
Ah,
It basically tells them to slow down, stop building. So less collagen gets made and the skin gets weak, very weak.
okay. Too much steroid hormone. How does a cat end up overloaded like that?
Two main pathways described in the sources. The first is iatrogenic. Fancy word, just means caused by medical treatment.
Ah, like giving the cat steroid pills.
Exactly. Too much or for too long. Prednisolone, those kinds of drugs. Or even certain hormone treatments like magistral acetate. And the sources, they suggest this is probably the #1 cause vets actually encounter.
The most common. Okay.
Yeah, likely. The other way is spontaneous. This is where the cat's own body goes haywire and produces way too much cortisol.
That's Cushing's syndrome, right?
That's the one, hyperadrenocorticism or Cushing's. Now, spontaneous Cushing's, it's genuinely rare in cats. Really rare.
But when it happens?
It's very, very strongly linked
Yeah.
to this extreme skin fragility based on everything we have here.
So, okay, steroids for meds or this rare internal Cushing's. But I thought one source mentioned other possibilities too. It wasn't only steroids.
No, you're absolutely right. Steroid excess is definitely the big one, the main driver. But the material also lists other really severe systemic diseases, things that completely wreck the cat's overall health.
How do they cause fragile skin?
Usually through things like extreme weight loss and muscle wasting. The term is cachexia, or severe malnutrition, or major metabolic problems. Basically, the body is so stressed just trying to survive, it can't maintain healthy skin anymore.
Okay, so what kind of diseases are we talking about?
Really serious stuff like severe liver disease, could be fatty liver, could be liver cancer, cholangiocarcinoma is mentioned, severe issues with the pancreas like pancreatic cancer,
Wow.
other types of widespread cancer, especially ones that cause that cachexia, that wasting away. Even some chronic infections like FIP or FFV are listed as possibilities.
It's an FIV.
Yeah.
Yeah.
Or even just end-stage kidney failure. Anything that causes profound cachexia or malnutrition, essentially starving the skin of what it needs.
It really sounds like the skin is just the last priority when the body's fighting something huge internally.
That's a really good way to put it. It's a visible sign of a major internal breakdown. Now, the sources also mentioned differentiating this from something called cutaneous asthenia.
Oh yeah, Ehlers-Danlos.
Right. That's important because it sounds similar, but it's different. That one's genetic congenital. The cat's born with faulty collagen.
And the skin is stretchy, right? Not thin and tear-prone.
Exactly. Loose, hyperextensible skin, usually seen in young cats. FSFS, the condition we're focused on, is typically acquired later in life, and this skin is thin, fragile, tears easily. Big difference.
Got it. Okay, that distinction helps. So if FSFS is usually this red flag for a serious internal illness, the cat must be showing other signs too, right? Not just the skin.
Absolutely. And spotting those other signs is critical for the vet to figure out which underlying disease might be the culprit.
Makes sense.
So for instance, if it is hyperadrenocorticism, Cushing's, or maybe related diabetes, the sources say look for things like drinking a ton more water, peeing a lot more. Vets call it PUPD.
Increased thirst and urination. Okay.
Yep. Maybe a bigger appetite, but weirdly, still losing weight, losing muscle. They can get that kind of saggy, pot-bellied look. And the material points out something striking. About 80% of cats with spontaneous Cushing's also have diabetes.
80%. Wow. Okay. So those often go hand in hand.
Very often.
Yeah.
Now, if the cause is one of those other big ones, liver disease, cancer, bad infection, the signs might be more general, but still really serious.
Like what?
Like totally off their food, really lethargic, no energy, significant weight loss, maybe vomiting.
Yeah.
And if the liver's involved, you might see jaundice, that yellowish tinge to the skin or eyes.
Okay.
And for things like FIP or FFIV, you might see persistent fevers, swollen lymph nodes, maybe fluid building up in the belly or chest, eye problems. So yeah, the skin flags the problem. These other signs help point towards the type of problem.
It's like being a detective, trying to piece together all these clues from the cat's body. So how do vets actually diagnose it? Both the skin thing and the hidden cause.
It's definitely a process. Starts with the basics, getting a thorough history from the owner,
Yeah.
doing a really careful physical exam, noting that characteristic skin fragility, and actively looking for all those systemic signs we just talked about.
And how do they confirm it's definitely FSFS affecting the skin?
The gold standard, according to these sources, is a skin biopsy, sending a small piece of skin off for histopathology.
So a pathologist looks at it under a microscope.
Exactly. And what they're looking for to confirm FSFS is severe thinning of that dermal layer, seeing collagen fibers that look thin, broken up, just not much there. And often less subcutaneous fat, too.
Okay.
But there's a catch mentioned in the sources. Actually getting that biopsy can be tricky.
Because the skin is so fragile.
Precisely. You risk causing more damage just trying to take the sample, and the site itself might heal really poorly afterwards. It's a challenge.
Right. But confirming the skin is just step one, you said.
Absolutely. The most crucial part is the hunt for that underlying disease. And that involves a battery of tests detailed in the sources. Routine blood work CBC, chemistry panel is vital.
What are they looking for there?
Things like high blood sugar, suggesting diabetes, elevated liver enzymes pointing to liver trouble, signs of infection, anemia, all clues.
Makes sense.
Then your analysis. Checking for sugar in the urine, which again points to diabetes.
Yeah.
Or maybe really dilute urine from all that drinking, which hints at hormonal issues or kidney problems.
Okay, blood and urine tests. What else?
If Cushing's is on the suspect list, you need specific hormone tests. The sources mentioned the low-dose dexamethasone suppression test, the LDDS is a common one. See if giving a small dose of steroids suppresses the cat's own cortisol production like it should.
Right.
There's also the ACTH stimulation test. That one's maybe more useful for confirming if steroid medication is the cause, a bit less reliable for diagnosing spontaneous Cushing's in cats, according to the material.
Okay.
And they might use a urine cortisol to creatinine ratio as sort of a screening test. Plus, obviously, checking blood glucose and fructosamine levels is key for diagnosing and monitoring diabetes.
And imaging, do they do x-rays or ultrasounds?
Imaging is huge. Abdominal ultrasound is particularly important. It lets the vet get a good look at the adrenal glands, those little glands near the kidneys that make cortisol. Are they enlarged? Is there a tumor?
Ah, looking for the source of potential Cushing's.
Exactly. And ultrasound also lets them examine the liver, the pancreas, other organs, looking for tumors, inflammation, anything else that could be the root cause from that list of other diseases.
Any other imaging?
The sources mentioned CT or MRI might be considered, especially if they suspect a pituitary gland issue in the brain causing the Cushing's, but that seems less common and potentially harder to interpret in cats.
Wow, okay. That's a really extensive workup. It sounds incredibly complex to diagnose and manage. What about treatment? Is there like a special cream or bandage for the skin itself?
That's the really tough part highlighted in the sources.
Mm-hmm.
There is no specific treatment for the fragile skin itself, nothing you can rub on or wrap it in to just fix it.
Oh,
The treatment has to be entirely focused on finding and hopefully successfully treating whatever that underlying systemic disease is.
so it completely depends on what they find in that diagnostic hunt.
100%. If the detective work points to iatrogenic steroid, the cat was getting too much medication. Then the absolute key is to slowly, very carefully, taper that medication down and eventually stop it.
You can't just stop it cold turkey?
No, absolutely not. That can cause a whole different dangerous crisis. So slow taper, find other ways to manage whatever the steroids were being used for initially. And the good news, the sources say, is that this cause can often be reversed.
Oh, the skin can get better.
Yes, if the steroid medication is successfully removed, the skin can gradually regain some strength. It takes time, months usually, but improvement is possible.
Yeah.
That's the more hopeful scenario.
Okay, and what if it's spontaneous Cushing's, the rare kind?
That's tougher. Treatment often means lifelong medication, like a drug called trilostane, to suppress the body's cortisol production. Or, if there's a tumor on one adrenal gland, surgery to remove it might be an option. Pituitary surgery is mentioned but described as very rarely done in cats.
And if it's diabetes?
Then it's insulin injections, dietary changes, managing the diabetes is key.
And for all those other serious things, liver disease, cancer.
Then the treatment is whatever is appropriate for that specific, often very serious condition, which unfortunately might be limited depending on what it is and how advanced it is.
So, while you're treating the underlying cause, what do you do about the constantly tearing skin? Just hope for the best.
No, you have to manage it. Supportive care is critical. That means handling the cat incredibly gently, like unbelievably gently.
Right.
Cleaning any wounds meticulously with sterile saline or gentle antiseptics to stop infections. Using special non-stick dressings can help protect open areas, but the sources are clear. Trying to suture or stitch up big tears, it's really difficult.
Because the skin just rips again.
Exactly. The tissue often just won't hold the stitches, and healing is generally very poor anyway because of the underlying disease and maybe poor nutrition.
So protective dressings, gentle cleaning.
And making the cat's environment super safe. Soft bedding, no sharp corners on furniture, maybe keeping them separate from other pets who might play too rough. Anything to minimize trauma.
Given how serious all these potential underlying causes are, what's the actual prognosis? What are the chances for these cats based on the material?
This is probably the hardest message in the sources we looked at. The overall prognosis for feline skin fragility syndrome is generally described as guarded to poor.
Guarded to poor. That doesn't sound good.
No, it doesn't.
No.
The outcome really depends on whether that underlying cause can be found and effectively treated or managed.
So if it's the medication cause, the iatrogenic one, and you stop the meds.
That's the best case scenario generally.
Mm.
The skin fragility can improve significantly in those cases, according to the sources. Similarly, if it's Cushing's or diabetes, that can be brought under really good, stable control, which is often a big if in cats, you might see skin improvement too.
But if the underlying cause is untreatable, like aggressive cancer?
Then the prognosis is poor. If the underlying disease can't be fixed or managed effectively, the skin fragility just persists. That means chronic wounds that won't heal, constant risk of infection, pain, discomfort.
That sounds awful.
It is. The sources mention complications like those chronic non-healing wounds, secondary infections setting in, fluid loss through the damaged skin, and ongoing pain.
So, what happens then?
Sadly, the material indicates that when the condition becomes unmanageable, when the quality of life is severely compromised, especially with things like difficult-to-control Cushing's or advanced cancer, euthanasia often becomes the most compassionate option to prevent further suffering.
Wow. Okay. This deep dive, it really paints a picture of a condition that looks horrific on the surface, the skin, but it's actually this window into a massive internal crisis.
Exactly.
The focus has to be on that root cause, even though finding it and treating it sounds incredibly challenging.
It absolutely is. And it really highlights how interconnected the body's systems are, doesn't it? Something that seems like just a skin problem is actually a sign of profound metabolic or organ dysfunction. The body is basically signaling system failure.
Yeah. Well, thank you for sending in these sources. This was difficult, but really important to understand the depth of this condition. And it leaves me with a final thought, If so many different serious internal diseases can manifest outwardly in such a dramatic way, like this fragile skin, what other, maybe more subtle signs might we miss? in ourselves or our pets, signs that seem isolated but are actually signals from a deeper issue within the whole system. Makes you think.